Yes.
No.
I didn't watch. I watched it. It's like 30 minutes. I didn't see anything. I thought it was a big story. I wonder that.
Yeah.
I think one time. Oh,
It's what we've been putting cards.
We all set in the back?
all set.
Everybody all set?
Yeah.
Okay. Good morning, everyone, and thank you for joining me. My message this morning is very simple and clear. It is time to move forward. We have been negotiating in good faith with the New York State Nurses Association for 6 months, more than half a year, to advance a contract that puts our nurses first. Yesterday, we presented our last, best, and final offer to the New York State Nurses Association for a new contract. Why? For over 32 weeks, Albany Med has come to the table prepared to reach an agreement. Our package proposal is an excellent one, with significant increases to base hourly wages and additional investments in our staff. It is an excellent offer and one we want to give our nurses immediately. Allow me to explain them in detail. The proposal Albany Med placed before NYSNA yesterday includes increases to base hourly wages, and let me give a few examples. We would immediately increase the starting rate for a newly licensed RN from $33 an hour to $37.50 an hour, and over the next 2 years, that would increase to $39.50 an hour. Also, when we look at our nursing workforce in total, including new graduates as well as experienced nurses, our contract proposal would see increases to RNs for base salary by, on average, 13% in the first year, and ranges from 25 to 34% over the course of the next 3 years. That is just base salary. We would also offer enhancements to special pay programs, and let me list some of them. Charge pay, which is a nurse who's responsible for their particular unit, would be increased. Preceptor pay, which is a nurse who is responsible for orienting a new nurse on their unit, would be introduced. And premium pay, which is signing up for shifts that are often difficult to fill, would be reinstated. In addition to those economics, we would pay for uniforms at Albany Med's expense for our nurses. We would increase reimbursement for tuition and continuing education and advanced certifications up to $4,200. We have put forward a staffing model that aligns with our 2025 clinical staffing plan as submitted to the New York State Department of Health by the Albany Med Clinical Staffing Committee, which has, I'll remind you, voting members from frontline nurses on that committee. Our proposal would have a standard vacation scheduling policy. It would maintain each nurse's choice to pay union dues or not. And importantly, our offer also would increase base salary retroactive to the first pay period after August 1st, 2024, when the prior contract ended. Retro pay. That piece, retro pay, is time limited and contingent on this deal being accepted by next Monday. Since we first began negotiating with NYSNA, Albany Med's guiding principles have never wavered. Fairness to all employees, fiscal responsibility, and quality patient care. We have remained focused on the facts. And we have never stopped listening to our nurses. We have never stopped advocating for our nurses. And of course, we never will. I am confident that our contract proposal is an excellent one. It respects our nurses for their expertise, for their compassion, and very importantly, their individual rights. To remind you, Albany Medical Center is one of few hospitals in New York that is an entirely open shop. Open shop means no one must pay dues simply to work there. It is an important fact to emphasize. We are not looking to establish Albany Med as an open shop. We are an open shop. We are an open shop today. Our current contract signed by NYSNA 4 years ago with their full agreement was to be an open shop. They are the ones looking to change that. We are not. And for me and for Albany Med, this is also about recruitment and retention. Many of the nurses who come here, many of the nurses who stay here tell me the reason they do and the reason they stay is because they like to work at a hospital that does not require them to pay dues as a condition of employment. NYSNA has offered no meaningful changes to their proposal since October 1st. And every one of their proposals have as a requirement that upon ratification, every nurse at Albany Med would immediately be auto-enrolled into the union and start paying dues immediately. Again, I emphasize that would be a change from our current contract, as would all future nurses. And all nurses would be required to pay dues as a condition of employment. That is simply not fair to our nurses. Today, the majority of our nurses do not pay dues. Not all nurses want to pay dues. Nurses should not have to sacrifice their hard-earned money to a third party for the right to hold a professional position here at Albany Med. Albany Med has been ready to make a deal for months, but NYSNA has prevented any progress because it wants to put the nurses' money in their pocket. Albany Med would never agree to that, and I certainly will not agree to that. The union does not like to talk about that issue, but that is their true intention. And their sensational distractions have muddied the waters. Through their insistence to hold back a vote on our proposal, this process has prevented us from moving forward on providing well-deserved benefits to our nurses, and we can wait no longer. Now is the time for the union to act. Our proposal is, as I said, time limited. NYSNA will need to respond by Monday. We hope they accept our robust and, I repeat, excellent contract offer. And you may ask, why is this our final offer? Why is there a deadline? As you know, we also face great financial uncertainty going into 2025. Negotiations with CDPHP are ongoing. In 2024, the insurance company has not reimbursed the hospital for up to $40 million in withheld payments contractually obligated to Albany Med, and has proposed in 2025 a contract that would not cover the cost of care provided to their members. Because of the potentially significant impact this could place on this hospital and our finances next year, the retroactive pay would come off the table if the union does not agree to Albany Med's proposals. We need to plan for the future. We need to invest in our workforce. We need to preserve the scope of services and the level of care you expect and deserve from Albany Med, many services that we are the only ones to provide in the region. We are the region's largest private employer and provide the most essential and advanced medical and surgical specialties in the region. Let's get back to the heart of our mission. I'm asking NYSNA today, directly, take the deal we have put in front of you so we can move forward together. I assure you, the overwhelming majority of our nurses at Albany Med want this contract. They are speaking up and doing so with clarity and passion. They want to vote. They want this contract. I hope that NYSNA will listen to our nurses. I know I have. I know Albany Med has. They are, after all, part of our Albany Med family, and we want to get this done, and we want it to get done as soon as possible for them. Thank you, and at this time, I'm happy to answer any questions.
I have a question. Can you just elaborate a little bit more on the deadline, on the Monday deadline? And, obviously there's a lot of financial questions with that 40 million you guys are owed. So why that deadline? Can you just kind of elaborate a little bit more?
I appreciate the opportunity to clarify because I think it's important to understand why those two things are linked. First of all, the deadline is Monday, December 9th at 5 p.m. And what we are asking for is by that time, the New York State Nurses Association, the team that is negotiating with us will come back and agree to bring this forward for a vote to our nurses. I will repeat, the overwhelming majority of nurses here at Albany Med, the overwhelming majority want to vote and they want this contract done. What is time limited in this offer is the retro pay. All the other, I would say, excellent economics and benefits and staffing proposals and the open and close shop, all that has always been in the proposal we brought forward. In order to really move this forward, in order to have a call for action, in order to get this done, we put on the table an offer for retro pay. However, as I pointed out, obviously the financial situation for the region, for hospitals in the region is uncertain. And as we've talked about, we're currently having discussions with CDPHP about how we will be paid back the money that was withheld from us, how we will negotiate a contract for 2025. And it is very clear that we need to have clarity on what our contract looks like for 2025 so we can understand how we'll move forward financially in 2025. So the retro pay is the time limited piece. And the reason why it's time limited is because I'm certainly prepared today, despite the fact that we have uncertainty out there in the payer market, I'm prepared today to say, I still want to give that deal to our nurses. They deserve it. I want to give it to them. But we can't do this indefinitely because we have to make certain decisions about what we're going to be prepared to take in a contract with all the different payers in the region.
If NYSNA does not accept this contract deal, do you have an alternative plan?
The plan is, first of all, between now and next Monday, the plan is to speak directly to all of our nurses, which we're doing, individually, at a unit level, collectively, and say, we want you to speak up. We want you to call for a vote. We want you to let them know that you want this excellent contract with increases to base salary, increase to enhanced benefits, a staffing model that's consistent with what we submitted to the state, and optionality on paying dues. If we get to Monday and NYSNA has not heard that loud voice coming from our nurses, then the retro pay piece has to come off the table for the reasons I just described, because we have to make other decisions. And then we would honestly keep our original proposal on the table and we would wait for them to come back to us.
What other decisions are you looking into?
The decision, let me be very clear, the decision now is entirely in the hands of NYSNA. Right? We put on the they're not bringing forward any new proposals. They've not brought forward a meaningful proposal since October 1st. We're the ones who are bringing forward new ideas, including this retro pay. So it's up to them to listen to the nurses here who are saying in one voice, as loud as they can, we want this deal. Please bring it forward for a vote. So my hope, optimistically, is that they're going to listen to them and they're going to bring this forward. If we reach the deadline on Monday, to answer your specific question, and if they've not agreed to bring it forward, what we've said is that retro pay, that's the time limited piece, that comes off, but all the other elements of the contract that we proposed would stay there. And then ultimately, we would hope that they would accept that. But the individuals, to be very clear, who would be harmed by that decision, by NYSNA, would be our frontline nurses, right? Because they would lose the opportunity to get that retro pay.
Would you ever accept an offer where you did have a closed union shop for your nurses so they would have a contract and not have to continue waiting for several months, as you said?
To be very clear, from the beginning, we've always held on to the position that we should be an open shop because it allows for choice for nurses. We know from a recruitment and a retention standpoint, two things that NYSNA talks about a lot. We believe, and I think the facts support, that nurses are willing to come here, work here, and stay here because of the optionality. And I'll point out, NYSNA themselves agreed to an open shop 4 years ago, right? That is in our current contract. So if you're asking me if that's a position I would move off from, the answer is no.
Are there any other issues aside from, making it, union hospital? Was there any other issues that they brought up that are sticking points for you guys?
from my standpoint, I think the contract proposal we have is excellent. If you listen to NYSNA, I'm sure they'll come out with a press statement or maybe offer something. What they were going to point to is they'll say staffing, right? Because it's easy to throw out the word staffing and make what I would call a false assumption or false statement that the staffing in the hospital is unsafe. In point of fact, the staffing is excellent and improving. I can tell you right now that in the last year, we've hired over 250 nurses here at Albany Med. I can tell you that the turnover rate has gone down. I can tell you that over 100 nurses who left for a period of time and went and worked at other places are coming back. And I can tell you that when we look at our staffing every single day, it's better than it was 6 months ago. In addition to that, we have well-established programs with all the local nursing schools in the area, Maria, Sage, Hudson Valley. We just are starting new programs, even with Sage and UAlbany. And while it's easy to throw out the word and say staffing, as if that is sort of the issue, I would remind all of us again, the New York State Department of Health requires every hospital to submit a clinical staffing plan. That clinical staffing plan is created by and approved by the Clinical Staffing Committee. Here at Albany Med in 2024, they created the staffing plan for 2025. On that committee are frontline nurses. Those nurses include those nurses who also sit across the street at the bargaining table from NYSNA. It was approved 100% unanimous. And what we've said in this contract, and what I think is absolutely appropriate, is what we will staff the hospital for in 2025 is those numbers, are those numbers. And we're making great progress. In fact, the HR team is already actively recruiting nurses for next year. And again, remember what I said, the base starting salary for new nurses here at Albany Med in our contract would increase, okay? And it would increase from $33 an hour to $37.50 in year one. It would get up to $39.50 by year three. That in and of itself is a recruitment strategy. That is a retention strategy as well. And that's why I say that when they say staffing, I say contract. Because getting this contract done is the best thing we can do to help us with our staffing.
Yeah, they were talking about staffing. That's been, a big issue for them. The other thing was, they've had such issue with it. They were making complaints to the Department of Health. There was that report. A lot of them have been complaining, saying they were never shared that information, that they were only shown snippets, cherry-picked information. Do you plan on releasing that full report to them ever?
As we talked about, it's a great question. I'm glad you asked. As we talked about last time, the process by which a regulated entity, and like a hospital, is inspected by a regulator like the Department of Health is one that we've done for many, many years. And that process is the regulators come in, they look at the hospital, they determine whether or not there's any deficiencies, they issue a report. It's the hospital's duty to respond to that by giving back a plan of correction. That process is iterative and it's not completed yet. As we've always said, when that process is totally done, all that information is immediately made available to the public. But I think it's premature to release anything to a third party until we've completed that process with the Department of Health. And I will say, since you brought that up, interestingly, since we last met in this room, we've been visited again by the Department of Health. They came in for an unannounced survey. They brought a team here. They were here for 3 days. They walked out the door. They said they found no issues at all. They issued no deficiencies, and they're extremely complimentary of us. In particular, they spent a few days down in our emergency department, which obviously has been a focus of some attention lately, and thought that what they were seeing as far as efficiencies, operational improvements, and patient flow was significantly better than they had hoped to see. So that was very encouraging.
Where is the process at right now? Do you have a timeline on when that information might be released?
You're talking about the deficiency?
The report.
That is entirely in the hands of the Department of Health right now. So we have submitted back to them our plan of correction, and we're waiting to hear back from them. And honestly, I think, these things sometimes take weeks to months. So I just don't have a particular answer, but obviously, when we hear back from them, we'll know whether or not the plan was acceptable or not, or if there's any other changes they're looking for us to make.
Is this contract deal essentially an ultimatum to the nurses union, take it or leave it?
It could be characterized as an ultimatum. I would characterize it as an excellent offer, right? And one that honestly, I truly believe our frontline nurses want. As I began by saying at the beginning, it is time to move forward. It's not the type of work that I think anybody wants to do where they wake up each day and they feel as though they're in this struggle, right, with somebody at the negotiation table. It's important work. We know it has to be done. We know that obviously every few years you have to do it. But ultimately what I want to do is get this contract done so our nurses will get their retro pay. They would get their significant increases to base salary. They would get all the other enhancements that I've listed out here. And quite frankly, we can focus on moving forward. We've done a tremendous amount of work in the last year here, bringing on board a new electronic medical record. We have services here that are unique in the region that we provide. I would love to go into 2025 with this contract settled. I would love our nurses to go into the holiday season with a little additional money in their paycheck. And I would love to kind of look back to doing what we do best, which is taking care of our region.
Is there anything you can say to the validity of rumors about staff and service cuts at the South Clinical campus?
It's a great question. South Clinical Campus is a location over on Hackett Boulevard. It's the former Child's Hospital. We currently use it today as an ambulatory surgery center that has functionality for 8 different operating rooms. And obviously, as you know, over the last many years, there have been multiple ambulatory surgery centers that have been built in the region. We've built some ourselves. Some physician groups have built some as well. Because of that, utilization in the outpatient setting has increased, but also patients have moved to different locations. What we want to do with our space is we want to run it as efficiently as possible. And rather than opening up each day and staffing 8 rooms, which means 8 different anesthesia teams, 8 different groups of surgical nurses, 8 different groups of scrub techs, we believe that we can run the same volume through 6 rooms. That's obviously the appropriate thing to do. It's better for patient care. It allows us to use the space more efficiently. Nobody who works at the South Clinical Campus is losing a job. Anybody who works over there now would be given an opportunity, and it's a relatively small number, to come back over and work in the operating rooms in the main campus in the same types of cases that they do today. And obviously in the future, if that volume grows again, then we would expand back to 7 or 8 rooms. So there's no question that today we are talking about using the space at South Clinical Campus instead of running 8 rooms, running 6, but that's really done because we want to run it more efficiently. And I think as a not-for-profit who ultimately wants to be good stewards of our resources, that's the right thing to do. But nobody is losing a job as a result of it. And we've been very respectful of the nurses over there and working with the limited number that would look to take space in our operating rooms over here.
I have one more question.
Yes, please.
So we've been talking about staffing a little bit. You were saying how you've added nurses, how you're working with colleges to recruit some nurses soon. Even with all of that said, are you up to par? Do you have a full staff here? Are you close to it?
Yeah. I think the work is never done. Right? If you ask me where we are today compared to where we were 2 years ago, I would say we're significantly better. Every single day, there's a lot of different dynamics that take place when you run a hospital, right? You have the number of nurses and obviously all other licensed or clinical care providers in the hospital. Same is true for respiratory therapists or lab techs or x-ray techs. You have a budgeted number. You have the number that you're looking to hire. You have a number that are here, but they're on orientation. You have some that are on some degree of leave. You have some that are scheduled to work but called out that day. On any given day, we adjust our staff in order to meet our patient needs, right? So if we have more admissions through the emergency department to a particular unit, we shift staff over there. If we have certain services that are lower, like over the holiday times, our operating rooms slow down a little bit, we shift staff out of there. To answer your question, I'm very confident that right now we have safe levels. I'm also absolutely certain that what we're doing as far as recruitment and retention is working. And I can objectively point to numbers that show you 250 new nurses hired, turnover rate going down, retention going up, more nurses coming back. And I'll emphasize, and this will always be the case, more work to do, always more work to do.
Thank you.
You mentioned that NYSNA hasn't had a meaningful proposal since October 1st. Can you kind of elaborate on that?
Absolutely, that's exactly it. So we meet every week with the New York State Nurses Association, typically every week. Each week you would expect one part to come in and say, okay, well, here was my previous offer. I'm going to make an increase here, or we'll meet in the middle on this issue. We've had over 20 different tentative agreements so far since we've met. But on the big issues, which is economics, right, base salary and other benefits, on staffing, and on the open versus closed shop. There's been no significant movement on the part of the New York State Nurses Association since October 1st. And I would contrast that with what we've done, right? The offer that we recently put on the table now includes a very significant change, retro pay. Retro pay. Just to put that in perspective, we're talking about going back to the first pay period after August 1st. Nurses are paid every 2 weeks. Those base increases to their hourly rate would increase by $4.50 an hour up to $5.50 an hour. So you can start doing the math. The recent offer we put on the table, this most recent change, would mean an additional few $1,000s, significant, to these nurses in retro pay, which is why they're like, many of them said, hey, listen, I thought the offer you had on the table originally was great. This is even better. On the other hand, NYSNA has made no meaningful changes in any of that. They're kind of stuck in on their proposal.
You said it was introduced at the bargaining table, was that yesterday?
Yesterday.
Do you have any inkling as far as, how they're feeling? What was their response when that was introduced?
I'm not in the room, but so I can't describe it. What I can tell you, though, is what the opinion of our frontline nurses is. Some of you may have seen, I put out a video yesterday. We believe a video is a very effective way to speak directly to our workforce, and I'm certain we can make that available to you if you haven't seen it. Many of our frontline nurses, in fact, probably all by now, have seen it, and I can tell you their enthusiasm for the offer is palpable. And so while I can't gauge what NYSNA is thinking, I can tell you the overwhelming majority of our frontline nurses want this deal. They want it. They want NYSNA to agree to bring forward this contract for a vote. Vote it up or vote it down, but bring it forward for a vote. And I believe that when given a chance to vote on this, the nurses would say they want this contract. And that's really the ask of NYSNA, right? Bring it for a vote. Bring it for a vote. If you believe that the offer we've put on the table is not a good one, then let the nurses make that decision. Any other questions? Okay, if you think of any afterwards, I'm happy to stay down here. I appreciate you making the time, and I certainly hope by next Monday we'll have some positive news that this will be coming forward for a vote. Thank you.
Thank you very much.